Stacy, can you tell us about ACER? What is the difference between community and individual level trauma?
Sure. So coined by the Prevention Institute, the term ACER is actually a tool that helps communities identify adverse community experiences and their resilience. It's used to help communities to develop strategies that promote community healing and foster resilience. When we think about trauma, we know that trauma occurs on both an individual and a community level. And when it occurs on an individual level, we often ask, what has happened to them? And at a community level, we might ask things like, what is keeping them from rebounding or recovering from what has happened? So when we think about trauma in general, we know that they are experiences and situations that are extremely emotionally painful. And for individuals, revisiting that trauma, becoming avoidant, having difficulty with emotional numbness, and becoming easily aroused can lead to violence. We know at community levels, when traumas happen across our social and cultural platforms, our physical environments, and our economic environments, it can also contribute to the production of violence, especially when communities do not have the capacity to organize to address it. They become frustrated, which can also lead to violence. So it's important that for us, looking at how wicked problems exist in our community, how to help our community break that cycle of unhealthy community deterioration, that we understand the different levels of trauma and what type of trauma exists in our community.
Thank you. Elaine, what is THRIVE? What does it stand for and how is it used?
Thank you, Ruben. THRIVE is a framework that can help you look at different factors in the community that impact health and safety. THRIVE stands for the Tool for Health and Resilience in Vulnerable Environments. It is broken down into 3 clusters: people, places, and equitable opportunities.
Great. So now we're going to talk a little bit about each of those clusters. Ashley, can you describe the people cluster?
The people cluster, you're thinking of the culture and social norms in the community and how they can contribute to trauma. Strategies to promote community healing and resilience involve identifying and connecting with individuals, with building trust and fixing disconnected or damaged relationships.
Courtney, can you talk a little bit about the place cluster?
Yes. So an example of some of the places symptomatic of community trauma include housing, transportation, our parks, industry. We can take a look at housing a little closer. In Lucas County, we see boarded up properties from drug raids. We see abandoned properties turned into shooting galleries. We see full shelters and homeless camps, and we see long waiting lists for public housing assistance and the demand for recovery housing. So what do? We acknowledge how these potential partners have been impacted by the opioid crisis. And from them, we start a conversation and we gather their data, we get their perspective, their strengths, their expertise, and their resources, and we have an opportunity to form a unique and creative partnership. We engage them to form strategies that will end up being mutually beneficial, all while working on our common agenda.
Great, thank you. Adam, can you describe how systems are impacted by these issues and also talk a little bit about the equitable opportunity cluster?
Sure. Like Stacy said earlier, trauma is an event, a series of events or set of circumstances that is experienced as physically or emotionally harmful and has lasting adverse effects. Trauma is associated strongly with chronic behavioral and physical health conditions, making trauma a harmful and costly public health concern. And the question we should be asking is not whether or not our communities have experienced trauma, but how has community trauma impacted our systems. And so when we start to look at this as a systems issue, not just an individual issue or a family issue, or any one segment of the community, but an entire system, one of those resiliency factors is having and enhancing equitable opportunities. This includes educational opportunities from early childhood all the way up, and having employers in the community who offer living wage jobs and have opportunities for advancement and advanced training.
Great, thank you. Cynthia, can you tell us why it's important to think at the community level?
Yes, when we're looking at working together across our entire community, a couple of the main advantages are that we can identify gaps in our programs and services, and we can also prevent duplication of efforts. Sometimes in this process, you'll hear an analogy to silos, and silos are towers where we store grain. So someone planted a seed, they harvested the product, and it's really some good stuff in that silo. But with this CCIM4C process, we'll come together. It's kind of like we're sharing what we've stored up, rather than staying kind of behind closed doors with all the good stuff. We come out to share it. And it also gives us a shared language, community level strategies, acknowledge the value of all sectors of our community. And it also recognizes the diversity in our experiences and also our ways of thinking. So a community approach can increase capacity, which we're looking at resources and readiness. And then we have to ask ourselves, are we really ready to do this? Are we ready to address the issue? And probably more importantly, are we ready and willing to work together?
Great, thank you. And Hamza, can you tell us a little bit about how coalitions can approach these issues with key stakeholders in the community?
You have to articulate the issue in a way that relates to them, whether indirectly or directly. For example, the faith community may have individuals in their congregation with issues such as addiction, or how having a drug-free community can increase productivity for employers.
Great. Thank you all very much.